systemic therapy for treatment of acne, antibiotics, systemic antibiotics. First, we will talk about the tetracycline, the systemic tetracycline. Although it has no effect on the actually the sebum production, it makes two actions. It decreases the concentration of free fatty acids, and these in dosage of 250 to 1 gram daily. This leads to anti-inflammatory effect. Actually, this occurs in many weeks, so also the clinical improvement occurs in many or several weeks. The second effect is that it has direct effect on propionibacterian acne. It leads to the direct depression of the number of propionibacterian acne. So it has anti-inflammatory effect and also antibacterial effect. The dose is, we can start with 500 milligram per day to 1000 milligram per day, and we can decrease the dose later on with improvement to 250 milligram per day or less. There is increased concern of resistant strains. Also, we can give tetracycline if the patient cannot swallow tetracycline, because it's better be used on empty stomach. So if the patient cannot use it on empty stomach for better absorption, we can use erythromycin. But also erythromycin has high rate of resistance, so it's better to keep it for a patient who cannot take tetracycline, like pregnant women or also young children. The resistance to erythromycin, actually it happens with systemic tablets and also with topical application. Doxycycline and minocycline also used for treatment. Doxycycline is more effective than tetracycline and less side effects and less drug resistance. Also, doxycycline can be administered by 50 to 100 milligram twice daily. Also, it has the side effect of photosensitivity. Regarding to minocycline, it is 100 milligram per day to 200 milligram daily, and it has the side effect of it has actually a serious side effects, rare but serious, so he should be monitored, the patient. It has blue-black pigmentation, especially in acne scarring and hard palate, alveolar ridge and anterior chins. Minocycline-induced autoimmune hepatitis and systemic lupus erythematosus-like syndrome, and oral clindamycin also is used but can cause pseudomembranous colitis. Long-term antibiotic therapy, there can be side effects that happens. With tetracycline, there could be yellow-brown staining of the teeth, of the developing teeth. Also, it can lead to decreased skeletal growth in the fetus, so it is contraindicated in pregnant women and in patients less than 8 years of age, in children. Only the one that can be administered for pregnant women is erythromycin. Another complication with long-term use of antibiotics is gram-negative folliculitis. It can be with either. As we said, there is another complication, rare complication, but we should be aware of, is the gram-negative folliculitis with prolonged antibiotic use. The gram-negative folliculitis can, or gram-negative organism can proliferate in the anterior nerves and spread into the surrounding skin. It can occur with two types clinically, and two types of organisms according to the organism. It can be only multiple pustules that increase inflammatory areola and near the nose, and it can be caused by Enterobacter or Klebsiella. Also, there is another type with deep indolent nodules. It usually comes from the Proteus organism, and we sometimes we make culture confirmation of the organism to give the proper antibiotic. We stop the antibiotics that we're using and use usually ampicillin according to the antibiotic according to the culture. Ampicillin is often used as treatment of gram-negative folliculitis, and the patient can continue on isotretinoin for maintenance and treatment of acne. Methoprim, sulfa, methoxazole combinations, citrine antibiotic can also be used but rarely be used, and the patient should be monitored carefully because it's potential hematological suppressions. So he should be monitored monthly if we decided to treat the patient with this antibiotic. Methoprim, sulfa, methoxazole combinations, citrine antibiotic can also be used but rarely be used, and the patient should be monitored carefully because it's potential hematological suppressions. So he should be monitored monthly if we decided to treat the patient with this antibiotic.